Hello, classmates and instructor. Welcome to my presentation over electronic health records. An electronic health record is an electronic record of a patient's information. The information within these records enables providers and healthcare professionals to make decisions regarding a patient's care plans. EHRs are unique and tell the patient's story. What kind of information is stored in these records? Well, there are several types of information that can be found in these documents, but here are just a few examples. History, diagnosis, medications, care plans, immunizations, lab and test results, and allergies. Some of the objectives we will be going over in this presentation will be describing how EHRs impact patient care, the benefits of utilizing EHRs, discussing data security and privacy. We will describe best practices for documentation and the future of electronic healthcare records. The use of electronic health records impacts patients in several ways. EHR represents the future of healthcare by enhancing the relationship between provider and patient. They also allow providers to spend more time interacting with patients. This allows for treatment plans to be more individualized. Access to record reduces the risk of duplicating tests, which could potentially harm the patient and disturb the treatment plan they are receiving. Electronic health records also improves how patients make health decisions because they are actively involved in their treatment plans. EHRs also offer messaging platforms that allow patients to ask their providers questions through a secure, confidential method. Overall, patients feel empowered because they strengthen their trust with their providers. Electronic health records have several benefits. Electronic health records provide security by only allowing authorized individuals to view and edit these documents. EHR systems allow healthcare providers to access patient data from anywhere within an internet connection, making it easier to provide care to patients in different locations. EHR saves a healthcare organization money by reducing costs. Many electronic health records reduce medical errors by providing an alert when information is incorrectly entered or if the information is missing. They also reduce the need to use paper. This allows providers to easily organize patients' information and keep it all in one area. Additionally, the use of electronic health records increases interoperability, which allows providers to easily share and communicate information between different organizations. Utilizing these methods of storing records increases the efficiency within a healthcare facility. Electronic healthcare records can do functions such as appointment scheduling and assisting in billing, which reduces the need for paper because the information is stored on a computer or device. Our next topic is data and security. Healthcare professionals must comply with HIPAA regulations. HIPAA sets the standards for protecting sensitive patient information, and compliance should not be optional. It is required to ensure the confidentiality and integrity of health information. One of the major risks associated with electronic healthcare records is unauthorized access. Unauthorized access can lead to the misuse of information and significant data breaches. These breaches can result in serious consequences, including loss of patient trust and other issues. Therefore, it's critical to implement strict access controls and regularly monitor who accesses these documents. In the unfortunate event of a cyber attack, preparation is important. Regularly backing up data is essential to prevent data loss. These backups should be stored securely and tested frequently to ensure they can be restored when necessary. Additionally, having a recovery plan in place is critical. This plan should outline the steps to be taken immediately following an attack, including how to restore data, commu- communication with stakeholders, and how to prevent future incidents. By following these practices, healthcare organizations can better protect patient information and ensure compliance with regulations. It is good to keep in mind data security is not just IT. It, it is everyone and it plays a critical role in patient care. Best practices for documentation. To deliver the best care to patients, it is important to practice efficient documentation. These practices include being patient-centered, using timestamps and signatures, and ensuring data is accurate and authentic. Focusing on patients ensure that their needs and preferences are taken into consideration when providing care. This can also lead to better patient outcomes and higher satisfaction. Timestamps and signatures are important because they provide a clear timeline of when information was entered, which is critical for tracking progress of care and for several different legal reasons. Ensuring that data is accurate and authentic is important for making informed clinical decisions. Inaccurate or unauthentic data can lead to misdiagnosis, inappropriate treatments, or potential harm to the patient, putting them in worse condition. It also helps in maintaining trust between the patient and the healthcare provider. As technology and medicine advances, I am sure the use of electronic healthcare records will too. Telehealth integration extends the reach of healthcare by enabling patients to receive visits quicker. This allows for shorter wait times and allows providers to communicate and create stronger relationships with their patients. The use of AI can assist in reducing medical errors and aid in diagnosing. The future of electronic health records will evolve as technology advances, and I'm excited to see where the technology will take the use of electronic health records. Electronic healthcare records has become very important in the healthcare field. The use of EHRs allow providers to easily access patient information instead of trying to find the patient's file in a stack of papers. They can easily pull up the patient's record, which will allow them to have more time to deliver better care to the patient. The privacy of the patient is critical because these documents contain sensitive information. With the use of converting to electronic, a patient's information is way more secure as to with paper. And whenever it's on paper, anybody can just view it, or they can easily become into the wrong hands of the wrong people when disposed or destroyed improperly. They also improve organization's efficiency by reducing costs in several different ways. Now we are going to go over current issues related to electronic healthcare records. The implementation of electronic health records requires appropriate planning and preparation for any challenges that could be faced. These challenges include cybersecurity, usability, cost of use, and training staff. With cybersecurity, again, in the case of a cyber attack does happen, that situation can disturb the organization by delaying treatment and preventing staff members to be less efficient, which can potentially put a patient's life in threat. Usability is important because it directly affects staff members. By providing an easy-to-use system, this can increase workflow. If the staff is struggling to use the system, this can lead to frustration, which can create other issues. It is good to make sure your staff are comfortable with using these systems. Although electronic healthcare records are costly, personally they are worth the investment. They make life so much easier. These systems have many advantages. As far as training staff, that is also an important aspect to consider. Providing training allows individuals to learn how to navigate the system and become comfortable using it. With staff being comfortable and confident in using the system, this can allow for higher job satisfaction. Stakeholders also frequently express concern of information being exposed due to the events such as natural disasters and cyber attacks. It is important to always have a backup plan in case of events like these. There are many more electronic healthcare record issues, but those are just a few that I listed. These are my references. Thank you for watching and listening to my presentation on electronic healthcare records.